The Public Protector's Office says it's looking into various cases of graft linked to the COVID-19 pandemic. The cases being looked at vary from PPE provision complaints, quarantine sites, as well as social relief grants. We're joined by Deputy Public Protector Advocate Kholeka Gcaleka, who's conducting site inspections at Mthatha General, Sulenkama, Livingstone and Uitenhage hospitals in the Eastern Cape tomorrow. Good evening and thank you so much for your time on News at Prime tonight. Firstly, maybe if you can speak to us about the extent of complaints that have been officially opened with the Public Protector's Office when it comes to graft under COVID-19 or linked to COVID-19. Advocate Gcaleka, good evening. I'm not sure if you can hear me.
Good evening to you and good evening to the viewers. I can hear you.
Okay, great. One of my first questions to you was that if you can give us a sense of the amount of the cases, rather, that you're dealing with that have been reported under COVID-19 or even linked to the corruption that has been taking place during this time.
The type of cases that we have received range from lack of services or no delivery of services at all in respect of water, sanitation, food, lack of proper services at hospitals, lack of operating equipment at the hospitals, procurement irregularities across government departments, the Bait Bridge border fence procurement process, waste management. Most of the complaints are from municipalities as well in respect of lack of services, basic services, in fact, that are not being delivered to the people.
It sounds like quite a wide range of complaints that you're receiving that also speak to the provision or lack thereof of multiple services. Are you finding that there are particular provinces that keep coming up in these complaints?
Indeed, our complaints range mostly from the Eastern Cape, Gauteng, Mpumalanga, KwaZulu-Natal, and we are also looking at other matters in the Limpopo province, the Northwest as well, in respect mostly of lack of delivery of services.
Given that there's so much to look at and all of it intrinsically is linked to the nature and the kind of services that people are able to access during this time, services that they desperately need, how are you treating these cases? So how do you prioritize what to investigate first?
We are dealing with these cases with utmost urgency. We've got an investigation plan. Mostly with the service delivery matters, we'll deal with them with on-call. We are able to call the particular department or even phone the department. We've had engagements with the Ministers of Basic Education, Water and Sanitation, and the Minister of Culture, wherein we've engaged them on at least having speedy resolutions for the complaints that we would be bringing forward before them regarding service delivery. And other more intriguing and intense matters, such as those that have or are alleging procurement irregularities, we've got investigative plans. We have put together a team that is specifically dealing and focusing on these matters, consisting of 10 senior investigators, led by a chief investigator, and that is being overseen by the executive manager, which report to the PP and I on a bi-weekly basis on the progress that would have been done on the matters, and they are continuously in interaction with the SIU, the Auditor General, as well as the FIC to ensure that we get as much evidence that we are able to get, and also look to tighten our collaborations with other institutions which are conducting investigations.
I'm keen to know, with the complaints around service delivery that have been raised, and when you actually go to the department heads or the ministers and ask them about perhaps certain projects that are not happening the way they should be, or the delivery of services, how does the public get to know about the engagements which you're having with the ministers? Because that in itself plays a key role in the process of accountability, and it's important for stakeholders to be able to see what the reasoning is being provided from those various departments for the lack of provision of those services.
I think the key factor is communication, which maybe on our side we have been lacking on because of the hard work that we have been doing on the investigation side. But it is something that we need to give a priority, where we are able to report back to the public and the public to know exactly how far we are in attending to their matters, and particularly the engagements with the ministers that we are having. However, we do have a mechanism where we report back to our complainants immediately after the complaint has been lodged, and we update them on a regular basis on the progress in their complaints. But I agree with you, the public at large needs to know the work that we are doing and the engagements that are taking place, and that their interests are indeed of priority, especially during this difficult period.
As it stands, have you been comfortable and satisfied with the kind of responses that you are getting from the various ministers that you've had to consult with during this time?
With the ministers that we've consulted with, yes, we've received much cooperation and they've made a commitment. However, outside of the engagements that we've had with the ministers, some of the challenges that we are having, particularly with the Eastern Cape province, that their response mechanism to us is quite not satisfactory. We are expecting a much cooperative approach. Ours is to execute our mandate to bring government to account to its people, and we need that cooperation with government. And we would expect government to say, if you are investigating, here is the information. But in the Eastern Cape, that is not what we are getting. They are sending responses through lawyers as if we are in a battlefield. But ours really is to ensure that we are able to hold them accountable as per our mandate in the Constitution.
Yeah, it's so interesting that you say that, because in the past weeks we've seen the Eastern Cape really become the centre of controversy in many ways when it comes to not just the province's response to COVID-19, but even some of the contracts that have raised eyebrows in that particular province. Speak to me about the work that you're there to conduct in the Eastern Cape today.
In the Eastern Cape, we are investigating. We have in fact lodged a self-initiated investigation into the scooters, the so-called scooter ambulances, and we have received complaints on the lodge in the Eastern Cape that is alleged to be owned by the daughter of the MEC, which was used as the quarantine site. We have also received a complaint regarding the Department of Education, the IT procurement that they are embarking on. And the other complaints are basically service delivery complaints, water sanitation in different areas in the Eastern Cape, but also on the state of hospitals and how people have been given medical attention in a manner that is not satisfactory. Hence, I am embarking on an inspection in some of the hospitals in the Eastern Cape to go on a fact-finding mission, and actually just to understand what the root cause is that is leading to the lack of proper service delivery, especially when it comes to issues of the healthcare system, which is quite paramount during this period.
Will you be in conversation with the province's Premier, Oscar Mabuyane, and the Health MEC, Ms. Gomba? And the reason I ask that is because there's a lot that has been said about her fitness to hold office, and I'm curious to know to what extent that might also be part of what you're looking into.
We've not been in conversation with the Premier. We have, however, written to the Health Department in the Eastern Cape in respect of the investigations that we are conducting. However, we will be engaging with the Speaker of the National Assembly, the chairperson of the Portfolio Committee for Justice and Correctional Services, which is the portfolio committee to which we account to, the Minister of Justice, as well as the Minister of Public Service and Administration, regarding the state of affairs in the Eastern Cape and how they are responding to us as a Chapter 9 institution.
So as it stands, are you saying that you haven't gotten any kind of response from the Health Department?
We have gotten a response through their lawyers, to which one of them they are seeking an extension so that they are able to respond to our complaint.